I'm giving, got some ambition, this new edition, filling positions, looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain, keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down.
You're listening to the Tom Ficklin Show on WNHH-LP 103.5 FM, your home for community radio.
Good morning, everybody, and good morning, Harry. Again, I've said this before, and I'm going to say it again, just to hear your melodious voice. Harry, at our station manager, helps to wake me up. And today's show is about really waking up, but I think the world wants to wake up, and the world wants to wake up and be safe and sound. And we're going to talk about what that means from a medical standpoint, and obviously this crisis, this pandemic that's affecting all of us. But there's some solutions and some light at the tunnel. And today's show is really to kind of inspire and to share why that light of the tunnel is emerging even ever so brightly, and some people that are really carrying, if I can say, the lanterns and the lights to kind of make it happen from the civic standpoint, from the medical standpoint, from the community standpoint. So today's show, I'm blessed to have Dr. Thomas Balcezak and Dr. Brita Roy with us, as well as the Yale Center for Clinical Investigation, two of their ambassadors, Sunday Black and Reverend Elvin Clayton. And we're going to talk about the impact of COVID-19 in communities of color and the elderly, but also discuss testing and treatment and vaccine distribution efforts and what we are collectively doing to address vaccine hesitancy in our community. And I must say, before I hand it over to our guests, that everybody can address this vaccine hesitancy situation. I was blessed to get my second shot yesterday, and I'm really excited about just being part of this movement. So Dr. Balcezak and Dr. Roy, good morning.
Morning.
How's everybody doing? And Sunday Black, how are you doing? Are you there, Sunday?
I'm here. All is well.
All is well. And Reverend Clayton, how are you doing?
Doing well, Tom.
Good. I love that. And we all need encouragement. But again, Dr. Thomas Balcezak and Dr. Brita Roy are our two medical guest, and Dr. Balcezak is I just want to take a moment to kind of mention, thanks to Tisha Johnson and the Yale Center for Clinical Investigation, we're able to bring in really, experts, and experts with a capital E and a capital X. Folks that are qualified, credentialed, and important in terms of this movement. So Dr. Balcezak is the Chief Clinical Officer and Executive Vice President at Yale New Haven Health. And Dr. Brita Roy is the Assistant Professor of Medicine, Assistant Professor of Epidemiology at the Yale School of Public Health, and Director of Population Health for Yale Medicine. Let's jump in. Dr. Balcezak, your role is across all the hospitals in the Yale New Haven network, and folks might not know that your reach extends to Bridgeport and Greenwich and even parts of Rhode Island. But tell us about your role as the Chief Clinical Officer and Executive Vice President for Yale New Haven Health.
Sure, thank you. And thanks for that kind introduction. And I really appreciate being on the show today. And I hope you're feeling okay after your second shot.
It's minor arm pain, just for off and on. That's it.
I think everyone would agree. I bet Dr. Roy would agree that it's really exciting to see you getting vaccinated, because the good news is now in 2 weeks, you're going to be fully immunized. That's really exciting. So congratulations.
Thank you.
So my role, I'm the chief physician executive for the hospital and the health system. And as you pointed out correctly, we have a network of hospitals and outpatient facilities that goes from the New York border across the 100 miles of coastline of Connecticut into westerly Rhode Island. So we have 7 inpatient campuses and 5 hospitals and a whole bunch of outpatient facilities. We're going to follow up with Dr. Roy in a second. There are doctors like Dr. Roy that work in our hospitals. So we have a number of physicians from the Yale School of Medicine that work not just here in New Haven, but across all of our hospitals. But we also have some physicians that work employed by the health system that see patients there. And we also have lots of community-based doctors. And so we like to think of ourselves kind of as, the institution where everyone comes to take care of people, and we deliver care to our communities. And that's really important to us because, we're based in Connecticut. We'll never leave here. And Connecticut's an interesting place. I mean, we've got some of the richest zip codes in the country, and we also have some of the poorest cities in the country.
Good point.
And we have to serve all the citizens, and our mission is to take care of all the communities that we are in, whether it's in Greenwich or in, inner city Bridgeport or New London or New Haven. And we have to tailor our programs, and we have to tailor what the needs are for those different communities. And Connecticut's a funny place in that, cities and towns are very different from one another. And even neighborhoods are very different from one another. And we have to be sensitive to all those people because that is our job, is to take care of people. So that's a little bit about what we are as the health system. And my role as the chief physician executive at the health system, it's sort of like we're a football team. And, we need the quarterback. Usually the doctor's the quarterback, but the doctor can't be the quarterback unless there's somebody to block and catch that pass. And those are the nurses and the pharmacists and all the different staff that we need to help take care of people. And my job is kind of like to be the coach, to make sure that those people are in place and that the physician's needs are served, ultimately for the goal of scoring that touchdown, which is a good care for people, good care for patients in our communities.
Excellent. And I love the sports analogy. I memean, whether it's football or basketball or baseball, or even golf for that matter, there's always the caddy and just whatever. Just us being on the same team and on the same page, or in the same choir for that matter. Dr. Brita Roy, as I say, is with us as well, and good morning to you again. And again, Brita Roy is assistant professor of medicine and assistant professor of epidemiology at the Yale School of Public Health, and director of population health for Yale Medicine. I know, Brita, I've mentioned that twice, but I just love saying that for people to understand that medicine permeates everything. It's in your bedroom, it's in your house, it's in your job. It's not just in the hospitals, and you're concerned with that. But tell us, in fact, you've been on the show before with Dr. Herbst when we talked about cancer in our community. But help us understand today a little bit about your broader role with Yale Medicine and as the director of population health.
Sure, absolutely. And I'll echo Tom's thanks for your really kind introduction, as well as my excitement for your vaccination. That's really great. Dr. Balcezak kind of already mentioned how Yale Medicine and Yale New Haven Health work very closely together. Yale Medicine is really the faculty practice of the Yale School of Medicine. So it includes doctors of all kinds, primary care and specialty care that have an appointment at the university. And some of our physicians practice in kind of Yale Medicine clinics, but many of us, like myself, do practice actually in the hospitals of Yale New Haven Health. So we work really, really closely together. And my role in population health, kind of as you mentioned, is broad. It's the merger of medicine and public health. And it really is focused on trying to improve equitable health outcomes across our population. And our population is quite large. Certainly it includes New Haven, but it also includes other areas of Connecticut as well. So as Dr. Balcezak mentioned, we practice in Bridgeport, in New London, in Greenwich. And so each of those areas, we can think of as our populations, whether the people living there necessarily come to our health system or not. As you mentioned, Tom, health begins really outside of the health system. It begins in our neighborhoods, it begins in our schools, it begins in our workplaces. And so thinking about our communities as places that can foster health and help people thrive, that's kind of how I think about population health. So it includes where we live and creating communities that can help to keep people healthy for as long as possible. It includes preventive care. So as you mentioned, I was on the show before talking about cancer and screening for cancer and mitigating disparities there. But also, once people do get sick, it inevitably happens. We also want to make sure that people across the board, no matter what they look like or where they're from, also have good outcomes, and we treat those illnesses as best we can with the best evidence that we have right now. So the long-winded answer to say that population health really encompasses a number of things, trying to make sure that people stay as healthy as long as possible, and that people from all places and all backgrounds have an equal opportunity to achieve that health.
That's really, really helpful. And before we go to COVID, I just wondered, Dr. Balcezak, whether you wanted to add on anything in terms of the interconnection between interconnection and maybe sometimes a substantive or a symbolic difference between how you're supporting healthcare in the community, how you and Brita kind of work together. Do you want to add on anything in terms of that or elaborate?
I was on mute. Really, it goes back to our founding. The hospital was founded in 1826 by a couple of Yale physicians, and really our histories have grown together. And in the modern era, starting really after World War II, you know, as medicine knowledge and abilities to create, you know, real clinical outcomes and improvements for patients grew, our partnership has strengthened and continued to grow. You know, it is the largest number of physicians that practice at the hospital are Yale medicine physicians. But more importantly, they also have a really important role internationally in terms of the research that they do, including some research about vaccine, which we'll talk about, I think, in a minute, but also training the next generation of all kinds of caregivers that take care of patients. We are one of the largest teaching sites in the country for young medical students that become physicians as residents. But we also train a large number of other kinds of practitioners. You know, there are nurse midwives and student nurses and radiology technicians. And we have a really, really important role together in training the next generation of clinicians so that we'll all have people to care for us when we get into the age categories where we might be retired. Good
point. I've been trying to retire for the last 20 years, but my wife has a different point of view about all this. Some of you that might be listening on the radio is fine, but some of you might be on Zoom or Facebook Live, and you may see this lovely face of Tisha Johnson, and you might want to wonder, why am I ignoring her? So Tisha, I don't want to get any calls after the show and say, you know, there's a little bit of sexism going on here, Tom. You're not so I didn't know before we go to COVID, if Tisha, if you wanted to say a few remarks to kind of bring you into the conversation.
Thank you, Tom. And for the listeners or those who are on Zoom, I'm usually here in the background. I don't know that I would say, like Tom, I'm the coach. I'm not exactly sure. Maybe I'm like an offensive coordinator or something like that on the football team. But I am the Deputy Director and Chief Operating Officer for our Center for Clinical Investigation, the home of a lot of the clinical research activity of the health system and the medical school. We help to support all of the clinical research that happens across the organizations. And we've been partnered with the ambassadors for over 11 years and very proud of the expansion of the partnership. And it's been wonderful being partnered with you, and just want to join the others in congratulating you on that second vaccine. We're thrilled to be a part of it. Now you can join the ambassadors in the hesitancy campaign, since we already have your photo from the prostate cancer.
Absolutely. Sign me up. We need it. We need a lot of people in this army. Sign me up. But let's go to COVID. Let's go to COVID. And sometimes I smile when I say COVID. Sometimes I frown. And I think even when you say the word, sometimes you may even want to be crying just to say the word. But it's going to be it's in our history. I mean, this word, this COVID-19 is in our history, for better, for worse. So, and we all currently have heard and seen so much data about that, and given the social media confusion, and I even call it the Tower of Babel syndrome that's kicking in. But we have people here on this show that can really help us to get some clarity, some information, and to learn and to share. So, and we know about the heavier burden that COVID has been placing on select populations. But Dr. Balcezak, let me turn to you first. You guys have been participating in excellent town halls hosted by the Yale and the ambassadors to really address the crisis. But I wonder whether you can share a little more about what Yale New Haven Hospital is doing in testing, treatment, and vaccination. People really need to know this is the an opportunity, a major opportunity?
Yeah, thank you for the question. It was a year ago last week that we admitted our first patient with COVID-19. And I don't think any of us really had the full anticipation of what the year was going to be like. But as you point out, it's been, unbelievably tragic in our country, particularly for some select populations. Some of our minorities in our communities has been devastatingly hit, not just here in Connecticut, but across the United States, and our elderly. And if you cross those two, elderly, minority, then you've really got yourself a real pickle. And it's been really devastating. So it's so important for us to get the message out about vaccination, but we'll get there in a second. With regard to treatment and testing, I think I'm very proud to say that the Yale New Haven Health System has been, I think, really well prepared at all of our hospitals. Of course, the COVID-19 epidemic crept up from New York, where it was so devastating and impacted Greenwich first, and then Bridgeport, and then us. But because of the way it spread, we were able to balance the load and shift patients between our institutions. And I'm really also very proud to say is that we mobilized our physicians and our other caregivers as a team. And all of our patients were cared for the same, no matter what location that they were in. And we experienced, it was unfortunate that there was mortality, but it was a very low mortality rate among our patients cared for. And as you pointed out, we've looked very carefully at how it's disproportionately impacted our Black and brown residents. And while we saw a much higher proportion of our population that were Black and brown admitted to our hospitals, once admitted to our hospitals, the mortality rate was no different than any other population. We actually, our group, one of our research group under Wade Schultz's leadership, Dr. Wade Schultz was able to publish this data. So we're very proud of that. On the testing end, we've got a number of mass testing sites outside in tents, and we've been operating them since really the end of April. So there's lots of access. You can go to our website if you want to get tested. If you're going to travel, you need to get tested for some of the travel restrictions in certain states, or if you're going to have a doctor's office, they sometimes require it if a doctor's visit. Or if you're symptomatic and you just want to know because you don't want to spread it, you can get tested. And all that's available right on our website. And then, of course, the most exciting thing, I think, for many of us is, what started back on December 15th, which is we were able to start vaccinating people. And to date, we've vaccinated more than 150,000 folks across really 14 large-scale vaccination sites across our health system. But we still have much, much more to do. Only about 55% of individuals over the age of 55 in Connecticut right now are vaccinated. And we really need to, as a population, get up to closer to 80% in order for us all to be protected, and for particularly our elderly to be protected, which is the ones that are most vulnerable in this. But that's a little bit of a quick through treatment, testing, and now vaccination. But really excited to be able to bring that information to you. So thank you.
Very, very important. And again, Sunday Black and Reverend Alvin Clayton are here with us, and guys will be coming to you in a second. They're the Yale Center for Clinical Investigation Cultural Ambassadors, two of the throng. But just hold your mule, as they say, and just stay patient for a second, because I want to continue with Dr. Rita Roy in terms of her. And Dr. Roy, I know you can walk and chew gum at the same time, so I'm going to throw maybe 4 questions at you at the same time, and you can choose which one you want to elaborate on or connect with. But it's just the interconnection of what you're involved with kind of just continues to astound me. But certainly you had that Yale-wide role in vaccine rollout and delivery, and I'd love for you to tell us a little bit about that role. But also, how are things going on the ground? People often hear through shows like this and through the New York Times of needless seagrass, but what's really happening on the ground? And when can people get vaccinated? I mean, when and where kind of thing is really important. And then how are you ensuring that our community can get access to the vaccine? So those are kind of hopefully not too overwhelming of a question suite.
No, sure. I'll try to cover them all, but if I miss something, then let me know. Right. So as I mentioned earlier, Yale Medicine is a very close partner with Yale New Haven Health. So since the beginning of the Yale New Haven vaccine rollout, the beginning of December, initially with healthcare workers before it was able to broaden out to the patients in public as kind of part of a very large and interdisciplinary team rolling out the vaccines to hundreds of thousands of people. And so this team certainly included, some physicians and clinicians and nursing staff, but also pharmacy was very involved, as well as our IT, information technology group, and a number of others to make sure we had the systems in place to be able to vaccinate such a large number of individuals. And there were, a lot of kind of logistical considerations that were important. So I'm sure, many folks heard with the initial vaccines, it required very, very cold storage, for example. Mm-hmm. And so making sure that you had the right storage and that when a vial of vaccine is opened, we're able to finish that entire vial before opening the next one, making sure that there's no wasted doses, things like that. So those are part of the logistics that we had to think about. But I'm really proud and pleased to say that the Yale New Haven vaccination clinics have been remarkably successful. One, just getting vaccines into people's arms. Pretty much all the doses we get, we administer within a week to people across the state. And again, this is across the geography of all the Yale New Haven hospitals. So we have 3 sites in New Haven, and these are all very large, we call mass vaccination sites, where we can vaccinate, more than 1,000 people a day. In addition to the 3 in New Haven, we have a couple in the Bridgeport and Milford area, as well as 2 in the New London area and 1 in the Greenwich area. We can give any vaccine that we are able to get. So that includes the Pfizer vaccines, the Moderna vaccines, and most recently, we gave the Janssen or Johnson & Johnson vaccine starting last week. So again, whatever we are able to get from the state, we're able to get out to people. Our clinics, I think, are extraordinarily well run. When people come in, they get to a vaccination station pretty quickly. We do monitor people for 15 to 30 minutes after they get the vaccine. The reason for that is just to make sure, that people don't have any immediate allergic reactions right after the vaccine. It has been shown to be extraordinarily safe, and most people are perfectly fine, but it is something new. So really, just as a precaution, we ask people to wait and be monitored. And also during that time, especially for, only really for the mRNA vaccines, which are Pfizer and Moderna, we're able to schedule people's second appointment to come back for their second dose. And again, I'm also really pleased and proud to say that Yale New Haven has gotten second doses to everyone that needed one and was scheduled for one as well. You asked also about how we're ensuring that the community has access to vaccination. I think that is something that's really, really critical. While we do have these beautiful, large mass vaccination sites, the process to get scheduled for an appointment there, as well as having to get yourself there, is not easy or accessible for everyone. And so now that we kind of have those big sites set up and they're running, we can focus our attention on populations that may have trouble. So for example, there's, a group of people that are homebound, right? That they're too sick. They can't actually leave the house to go get a vaccine. And these people are also extraordinarily vulnerable. So we've started a program where we can actually go to people's houses to vaccinate them. In addition, we have partnered, and I think we'll be talking about this later in the program as well. We've partnered with leaders in the faith community to create kind of pop-up vaccination clinics at local churches and neighborhoods in New Haven and Bridgeport and New London, again, in communities where perhaps it is more challenging to access our vaccination sites. And we are also outreaching to people by phone to see if they want to schedule a vaccination, because there's a number of people that don't have access to internet or are particularly savvy, with our website. And so by us calling them, we are able to get people scheduled in that way. And similarly, we're doing outreach with community health workers and partnering with local community-based organizations to kind of go door to door, meet people where they're at, give them information about the vaccine, and also help them get scheduled. And we do, have slots for kind of help for people in kind of more vulnerable areas, kind of lower income areas, again, that may not have access to be able to get the vaccine.
Well, I think Dr. Roy passed that test, does she not? I mean, she gets an A, you can A++. Yeah, you can move on to the next grade. And no, I mean, I laugh and joke, but the show is archived, and we have we're blessed to be able to disseminate it even after, if people can't listen on live at the moment. And just if people just hear what you've just said or listen to those last 5 minutes, that's so key to see the comprehensive effect. And you referenced the cultural ambassadors in the churches, and Reverend Clayton, I wanted to kind of bring you into the discussion as one of the cultural ambassadors to the Yale Center for Clinical Investigation, because I understand that your church in Bridgeport is either had or has had or will have a pop-up clinic vaccine site partnered with Yale. And tell us also what this really means for the community. I mean, I just love the fact that I've always been involved with community organization for the last several decades, and bringing people together regardless of title and status and elitism, and just sharing the communion of public health is something that's really important. So share with us a little bit about how your church has been involved with the pop-up clinical vaccine sites.
Thank you, Tom. And it's always a joy to be on your show.
It's a joy to have you.
We are one of the pop-up clinical vaccine sites in the city of Bridgeport through the efforts of the Yale Medical School and YCCI, especially in these unprecedented times. What Yale has done, spent a lot of time educating people, especially people of color and even our seniors, to help them feel more at ease or change the mind of those who are on the fence to take the vaccine. And what this has done, since it's in the local churches, it has given them a sense of comfort. And it's a familiar setting. And there were so many who had decided early on that they would not take the vaccine. There was a hesitancy that you would not believe.
Yes.
You have so many people who have died from Corona-19. But since we've had educational meetings and educational town halls, etc., and we've gone through various churches throughout the state, our people who were at a place of hesitancy have now, many of them have already taken the vaccine, and some will take it in the near future. Our only prayer is that those who are still hesitant, that they will come on board and have a conversation with their personal physician.
Reverend Clayton, let me stay with you just for a second, because just as you were talking, and correct me if I'm wrong, but I think I saw a picture of you and several ministers with publicizing the campaign. It's either in the Connecticut Post or a Connecticut Mirror. I see you in several pictures with the masks on, and other ministers kind of promoting in the Bridgeport area just the need to kind of save ourselves.
Yes, it's important that people see us practicing what we preach. It's important to, even though many of us have been vaccinated, to continue to social distance. It's important that we wear our masks. It's important that we do all the things that we need to do to remain safe and to help people who have not been vaccinated to do the same.
So again, I really enjoyed seeing that picture of you, and I think Reverend McCluster and 4 or 5 other ministers were in the shot. So that kind of, I don't get to church on Sunday every Sunday, but I still respect very much the profession that you're in. And speaking of Sunday, just before I come to you, I just wanted to mention, Reverend Clayton, tell us, because people might think that you're new to the party. On the contrary, you've been part of this initiative for a long time. So tell us about how your involvement from a research standpoint, and I believe you're also a participant in one of the earlier trials, but you've been working hard on these issues long before the vaccines were even thought about or needed to be approved. So, I'm just curious about some of your earlier efforts to support the research.
Is that question from me or Reverend Clayton?
Reverend Clayton.
Okay. I go back a bit. This is, I call it, this is Keisha Johnson's vision to make sure that the community, that people of color were involved in clinical research. And in order for us to understand what's going on today, we'd have to go back 10, 11 years. We were talking about heart disease and what research was going on at that time, and people with asthma and cancer, helping men to deal with the prostate situation. And we talked about obesity, and we had health clinics in our churches and in our parks and in community buildings. So when COVID did come along, we were already in place because of vision that Sister Tisha had already placed on the map. So when people hear us talking about COVID-19, we're not new faces.
Yes,
it's not a new thing, but it's just a continuation and enhancing the work that we started some 11 years ago. And you know that when COVID came along, all the focus was there. All the focus was there. So, and what really happened, the Yale is the bridge to the community. And the ambassadors is the vehicle that go back and forth to help the people receive the information, help the people feel more at ease, because we are familiar faces and people to whom we hope they trust.
Indeed. And Sunday, just before I come to you, just want to kind of give the opportunity to just repeat, and I love to repeat this, that, and Reverend Clayton, correct me if I'm wrong, but you have participated in a clinical trial before.
Yes, sir.
And survived and thrived.
Just for the record, I was part of the vaccine, the corona vaccine study. I received my vaccine August 31st, the first one and the second one September 14th. And I had no issues. No pain in the arm, no swelling. I didn't have a fever. It was so amazing. I thought that I received the placebo. But when the study became unblinded, like I said in the past, oh, happy day.
Excellent. Sunday, thanks for being patient. And Sunday Black is with us. Sunday's an active member, to say the least, active with the capital A at the Mount Olive AME Zion Church in Waterbury. Tell us a little bit about your experience, Sunday. I mean, you've been a Yale YCCI culture ambassador for a number of years, and really gets deeply involved with this issue from a generational standpoint, from young people, old people, middle people, just from a, if I can use a term, even from a missionary standpoint. So share with us a little bit about your experience in this regard.
So for me, let me just say this, Reverend Clayton, can you guys hear me? Okay.
Yes, ma'am.
Reverend, I'm going to elaborate a little bit on what Reverend Clayton said about the importance of our involvement with YCCI over these years. because it really did provide us with that foundation, right? And so we've been doing this for over a year. And so who would have thought a pandemic would have come about, right? And so just being able to have the knowledge and understanding of what a trial study is, what the regulations they go through, what happens in the event that, a pandemic does happen and they have to look at a vaccination and push that forward somewhat quickly. It just allowed us the opportunity to really have that foundation so that we can communicate with our communities to say, okay, hey, I know this is scary, right? But we're able to push that message. So for me, my involvement with YCCI, and I think I've mentioned this on your show before, really enlightened me a lot. And I say that in the most humble way because it really helped me to understand the importance of minorities being involved in clinical trials and clinical studies. And it really gave me that platform actually to understand my own medical, my medical doctors and my conversations with my doctors in a better informative way and how I should be communicating and asking questions, realizing that some of the medicine that I may be taken is not even medicine that was tried on African Americans, right? And so we're just doing trial and error here. But I want to kind of go back to our conversation with the COVID and what's happening in our communities. I will say this, that so there are several of our churches that are involved in the vaccination, getting people vaccinated. And I think what's important about it is that they're just not putting the information out there and saying, hey, we're having a vaccine clinic here, but we're providing information to say, hey, here's why it's important to get vaccinated. Not only here's why it's important, we're reaching out to folks, trying to pull more minorities into, coming to get vaccinated, helping them to make it easier for them and helping them to understand, the importance of letting it happen. I know we said this several times on this show and many of the town halls that we've been on, like a lot of people would think that, okay, if people would just understand that more of us are dying and it's just important to do it, but it's not always that simple, right? And so we have to be there to inform and help people understand, the importance of the vaccine, understand what's happened thus far with the trials and so forth. And so I'll credit that to YCCI, to Yale, because really they have kept us informed from the beginning. And we've met weekly, and we had questions and we went through that whole process. So, my experience, not just with YCCI, but particularly over this year with this COVID situation has been phenomenal. I mean, I've pulled my family together, had conversations, there's people in my family who are hesitant in getting the shot, and you're just being able to have those conversations with them and then sharing that with their friends. So, it's just been, for me, it's been wonderful because I've been informed and I can inform others of the same.
Excellent. And thank you for that testimony. And Dr. Balcezak and Dr. Roy, let's come back to you. And again, I share with my wife that as far as I'm concerned, if you turn on the news or read anything between now and the next 6 months, COVID is the only news in my mind. So, there are town halls all around. You can find information, but I don't think we can get enough because we really got to address this with everybody's attention and consciousness. But we've heard this term, Dr. Balcezak, herd immunity. And although sometimes it sounds kind of crass in terms of its connotation, but I would say communal health. We could even rephrase it to collective communal and collective health. But explain again what that means when we hear this term and why it's so literally and figuratively and substantively so important.
Well, thanks. You're right. I mean, some people have suggested we substitute the term community immunity rather than herd immunity, because I don't think any of us like to think of ourselves as a bunch of cattle. But, we are a population and, the virus spreads between people. And if you take people out of the equation, whether they be spread in distance or because of masks or they're immune because of vaccination, then you take the ability for the virus, to spread. And so in a way, I like to use the analogy of a forest fire, which is, if there's enough timber in the woods and the fire is going to spread. But if you can create a fire break, and we're all familiar with how firefighters do that, they cut a break in the woods so that the fire can't spread. Well, you can think of the masking and the distancing or the vaccination as like a fire break, which is it prevents the spread of the virus. And once the virus has no other people to infect, it can stop. And so this concept is, a fire break only works if you remove enough wood, or in the case of the virus, if you remove enough people that are susceptible to the virus. And so we got to get to the point where we create that fire break. And in order to do that, we need 80% of people, public health experts tell us, to get the vaccine. And so that's why it's so very important. If we only get to 30 or 40 or 50%, we're still going to have enough people and folks in the community that have the virus, and the virus will persist. If we get to 80%, we've got a real shot of making sure that this virus ends.
See, that's so important. And Dr. Roy, maybe kind of pick up on that theme in terms of accelerating people's adoption and increasing their confidence, if I will, and reducing their hesitancy in terms of the myths and the misinformation that we continue to hear. Tell us a little bit, if you would, about what you're doing to address this issue and help everyone get accurate, super accurate, on time and expert information.
Absolutely. So, we, as Dr. Balcezak mentioned, we do need to get, at least 80% of our community vaccinated in order for the virus to stop spreading. And in our data so far, we are seeing certain populations not getting the vaccine at the same rates as others. So our Black and Hispanic or Latinx populations are not getting vaccinated as frequently as white and Asian populations. And so, there's a couple of reasons for that. One certainly has to do with access. And we already talked about some of the things that we're doing to increase access. But another is that there are a lot of circulating myths and pieces of misinformation around the vaccines. And, these spread through social media and other ways. And so what we're doing to counteract that is to try to provide people with important and truthful and accurate information about the safety and the effectiveness of these vaccines and why it's so important to get vaccinated. So we've created a fact sheet, in collaboration with the community and community partners, again, in all of our areas in New Haven and Bridgeport, New London and Greenwich, and Tom and Tisha, I think you two also for being part of that group. But it's a fact sheet that's kind of really easy to read and just tells people, that the vaccines truly are shown to be extraordinarily safe and, essentially 100% effective, all of them, at preventing hospitalization and death from COVID, which is, that's phenomenal. In addition, we talked about the trials themselves. They were quite diverse. I get a lot of questions from my patients, for example, that are people of color, asking me if this was tested in people that look like them. And we can say, yes, it was. The vaccine trials had at this kind of the same proportion or more people of color in that the vaccine was tested in, compared to the population. And we see no differences in the safety or effectiveness, among people of color of any of these vaccines. So anyway, it I think does a good job, sharing what the facts are, addressing a lot of the myths and misinformation. We've also developed a nice simple side-by-side comparison of the 3 vaccines that are now available in the US that just shows, again, all of them are highly effective at preventing hospitalization and death, but the Janssen or Johnson & Johnson one is only 1 dose. And we're working on other kinds of like media and outreach and things like that, again, to address these issues.
Dr. Roy, the fact sheets that you mentioned, will those be available for folks to kind of take a look at or print out or share or share with people through social media?
Yes, absolutely. So we are just kind of finalizing them now, but they'll be available kind of through like the Yale New Haven website. The health departments will be circulating them, as well as the state's Department of Health. And we are open and willing to have any health system, clinic, community organization, anyone disseminate these as well.
Great. Everybody, Tisha's put in the chat if she could make a comment. Should we hold a vote or take a retreat or have a consensus? Thumbs up. Sunday says okay. Okay, I'm outnumbered, Tisha. I'm
You're giving
outnumbered.
me a tough time today, Tom. I don't know what's going on.
I'm outnumbered. It's true
I don't
love.
ask to speak very often, but
I
just wanted to. I wanted to just echo, what Brita was saying about all of the efforts that we have for putting the materials out. And also, I just wanted to say thank you to all of you who are on the call today. Tom and the support of our leadership to even develop the program and to help us with all of the things that we're doing. He's just been amazing. He helped us to arrange the pop-up clinics at the AME Zion churches. So I just wanted to say thank you to all the listeners, but it's everything that obviously Britta's been doing and you've been doing, Tom, but to the ambassadors specifically, they have been working really hard since, as they've told you, before COVID on so many diseases, but particularly hard to get information out, at the start of the pandemic to make sure everyone was safe. They work really hard to make sure that the vaccine was successful here in Connecticut. The vaccine trials that we had, 41% of our participation was from underrepresented minorities, people who had diabetes, high blood pressure, all kinds of comorbidities. And now they've been working really hard with us to get the message out and address issues related to questions and vaccine hesitancy. So I just wanted to say thank you.
Oh, for sure. I mean, these are days just to keep everybody's spirits up and to acknowledge the efforts that everyone is making. I mean, it's just so key. As Harry, the station manager, has indicated to us before we went on air at 11:55, we're going to get the boot. But let Harry know that we will be back again, Harry. So you can kick us off at 11:55, but we will be back very, very soon. But I guess one of the days we kind of wind down, if Reverend Clayton and Sunday, if you want to make any comments in terms of the town halls that you've participated in, any more of how you've been sharing information, and even in terms of the videos and newsletters. I think the YCCI, the Cultural Ambassadors, have a newsletter and some videos. So I didn't know if you wanted to make any remarks before we, I guess, have a few more questions before we conclude. Sunday or Reverend Clayton?
Sunday, I'll yield to you and I'll come after.
Okay. So I'll talk probably most about the most recent one we had. And I can't remember the number, Tisha, but I think we had like over 200 something people on the town hall that we had. I mean, I was excited about the town hall, not just because of the platform and who was on the town hall and the information we was putting out, but I'm gonna tell you, I shared that town hall with over 100 people. Like I really, I know being part of the church, and like you can send an invitation out to 1,000 people and 100 people show up, but I was trying to send it out to as many people as possible, right? And so I sent it out to over 100 people for that particular town hall, because I had been getting so many questions and I wanted them to hear it right from the doctors, right from the experts, like here's the same information I'm giving you. And so that town hall really was one of the moments, I guess, for a lot of the people that have been asking me questions to say, maybe I need to get this vaccine. And it was like, yeah, maybe you need to get this vaccine. I think the other piece about that particular town hall that we did get like a question and answer sheet afterwards that I was able to share again out to all of the folks that I invited to come, folks who came and who didn't come. But, I can't echo, or I can't say it too much, but YCCI has been really, really active and really, really making sure that we as a community have this information available to help Black and Brown people, right? Because there is hesitancy and it's just a fact, right? And so sometimes you're going to keep talking until your message kind of resonates with them. And so that's what we're doing. And I appreciate the information, because I couldn't go out and do this on my own by no means. So I appreciate it.
Indeed. Reverend Clayton?
Yes, the ambassadors were and is an informed group of individuals. And I would like to go back some 10, 11 months ago when the information was progressing and we were updated sometimes daily as to how to communicate to our people. As a result of it, members of my family, even my wife was a part of the COVID study. And just last week, my sister heard us speaking about these matters, and she said, well, I guess I'm going to get the vaccine now. Good. So it's not only people that we come in contact, but they're even begin to share with other people. So that sooner or later, the light is shining at the end of the tunnel. Yes. But we're going to get there if we just hold on a little while longer. As the president said, don't go too fast, but let's keep moving in the right direction, doing the things that we have been told to do, and we'll be able to join with our family and friends in the near future.
Great. I will share with you. I did take the vaccine with my mom, right? And so my mother was a little hesitant about the vaccine as well. And she's 77 years old, and she does have some underlying medical conditions. But we went together, so I made it like, let's do this together, right? And so, and plus my brother and sister had already gotten the vaccine, and they assured my mother that they were just fine. So,
That's key. We have about 3 minutes. I want to give a minute and a half to Dr. Roy and Dr. Balcezak to really just reflect on. We've talked in a way about what does the community need to know today, but I just wonder if you want to share your thoughts about how we can get back to a new and even better normal in 1 minute and 30 seconds each.
You want to go first, Rita?
Sure. I think, honestly, the best way, and essentially the only way to get back to some semblance of normal is to get 80% or more of our community vaccinated, because we cannot, stop wearing masks and stop distancing until, like Dr. Balcezak, described, until we can stop the spread of the virus. As long as it continues to spread, as people have seen in the news, the virus can mutate, it can change, and we don't want that. So the more people that can get vaccinated, the fewer people the virus can spread to, and the closer we are, to getting back to normal. And so I'm thrilled, that the current administration is trying to increase access and quantities, numbers of vaccines, so we can get to that goal, sooner than later this year.
Indeed, Dr. Balcezak?
Yeah, no, I want to thank you for inviting us on the show and for giving us this opportunity to talk. And I want to thank Tisha for setting up the Cultural Ambassadors Program 11 years ago so that we would have it in our pocket when we had a pandemic. We didn't know we were going to need it for a pandemic, but she was so prescient and smart about doing that. And I want to thank the ambassadors, because I don't think it came out in the show yet, but Tisha, am I wrong to say that one of the main reasons why we were able to have a Pfizer vaccine trial here in New Haven was because of the cultural ambassadors? I mean, that just shows the power of what you all have created. And the fact that we're able to have this conversation now with the community and have this whole structure, this beautiful structure in place, to be able to get that communication like Reverend Clayton discussed, I think just shows the power of what you've created. And it's just helping humanity. And I think at the end of the day, that's what we are. We're humanity and we're under attack. And I think that everything we can do to pull together to fight this virus is good. And I just hope that we can pull together and stay together to fight some of the other challenges that we have as humanity after we put the virus behind us. So I just want to say thanks.
Excellent. Let's say thanks to, I want to say thanks to everybody on the show, to Dr. Balcezak and Dr. Brita Roy and Reverend Alvin Clayton, Sunday Black and Tisha Johnson. And there we go. We're done. See everybody.
Take care. Thanks, Tom.
All right.
As I got another rhyme, another
This
rhythm
is
for
Harry
y'all to
Grove,
listen.
and
I'm
you're
never
listening to
quitting on my mission. I'm gonna roll with what I'm giving. Got some ambition, this new
103.5
edition,
FM,
filling
New
positions. Looking at the void in myself and feeling what's missing. Better watch the way you going. Better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. I'm never gonna give up. Fall down, I just gotta